Welcome everyone to The End is Near, Benefit Implications from Expiring COVID-19 Emergencies. Thank you all so much for joining us. Our moderator for today's call is Patrick Myers. He will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We'll be sharing the recordings in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'd like to introduce our speakers for today's call. Joining us today are Beth Allen, Vice President and Counsel of Benefits Compliance and Plan Documentation Operations at NFP, and Carol Wood, Vice President and Counsel of Benefits Compliance at NFP. Carol, the floor is yours.
Thank you, Amber, and good afternoon, everybody, and it's a pleasure to have you with us today as we discuss the wind down of the COVID-19 emergencies. Again, I'm Carol Wood, joined by my colleague Elizabeth Allen. We're today's speakers, and there's our picture if you'd like to see our smiling faces. And we just need to remind you before we start that this presentation is intended to be used for general guidance purposes only. It's not intended to be tax or legal advice. Any specific question of the application of the law should always be addressed by your legal counsel. And the information is current as of today, March 15th. All right, the big picture agenda. What started it all, the White House announcement. We'll discuss that briefly. And then we'll discuss the implications of the end of the COVID-19 public health emergency. First, I'll be covering that. And then Beth will be covering the end of the COVID-19 national health emergency. And hopefully we'll have time at the end to address your questions. All right, starting with the White House announcement. So on January 30th, the Biden administration announced their quote-unquote intention, it's a bit cryptic here, to extend the COVID-19 national emergency and public health emergency to May 11th, 2023, and then to end both emergencies on that date. And just to review, the national emergency was declared by President Trump on March 1st of 2020, and after numerous extensions was set to expire on March 1st. The public health emergency was declared by the HH Secretary back on January 31st of 2020 and was set to expire on April 11th of this year, again, after numerous extensions. And in this statement, the administration cites for their prior commitment to provide at least 60 days notice prior to the expiration of the public health emergency. And in particular, because with certain provisions of that, it simply ends. There is no built-in period, as we'll see with the national emergency. And they also, the statement also spoke about the need for an orderly unwinding of COVID-19 flexibilities, including Medicaid rules. How does the unwinding of Medicaid rules impact group health plans? Well, if you recall, under the FFCRA, states that kept people continuously enrolled in Medicaid during the public health emergency were eligible for increased federal funding. So as a result, Medicaid enrollment significantly increased. Now, essentially what happened here is that individuals, it's called continual enrollment, were allowed to stay on Medicaid, even if they otherwise might not have still been eligible. Under the Consolidated Appropriations Act of 2023, that was just passed last December, Medicaid continuous enrollment will end on March 31st of 2023, and states will begin disenrolling people who are no longer eligible. So many of these people may also be eligible for an employer-sponsored group medical plan, and their loss of Medicaid eligibility entitles them to a HIPAA special enrollment period. So employers should be prepared for potential new mid-year enrollees on their group medical plans. And just to point out, some of the projected numbers of the amount of people are as high as over 14 million. So that's a lot of people losing coverage. It's not immediate. It's spread out. The states will probably all do it a little differently, but likely through the end of the year, some of those they'll have a special enrollment and exchange coverage, but again, some may choose to enroll in the group medical plan. Okay, moving to the end of the COVID-19 public health emergency. On February 9th, HHS issued a transition roadmap for exiting the COVID-19 public health emergency, which explained really some of the reasons for the ends that the COVID-19 reported cases, deaths, and hospitalizations have sharply declined. And they also, there's a number of things mentioned, but of relevance to us, COVID-19 vaccines and treatments will shift to the traditional healthcare marketplace. And I think that's something important to keep in mind in general, that the federal government was really funding and distributing not just vaccines and tests, but treatments. There was a lot of government funds behind that. So they HHS hasn't received additional funds from Congress to purchase more vaccines and treatments. So there'll be a shift to the private market. And as a result, we may see some price increases. Coverage for COVID-19 testing, of course, will change also. The implications for the end of the public health emergency. The following changes will result. First, group health plans will no longer be required to cover COVID-19 testing prescribed and over-the-counter without cost sharing. Plans must continue to cover COVID-19 vaccines in network as required under the ACA as preventive care, but not out of network. The cost of COVID-19 vaccines and certain treatments may increase. For employers who took advantage of a standalone telehealth option, for those who weren't eligible for the employer's group health plan, those will no longer be permitted. And also, if any EAPs offered COVID-19 testing or vaccines, there was an exception where they wouldn't qualify as accepted benefits, but that also will be expiring with the end of the public health emergency. Okay, so looking more specifically at COVID-19 testing requirements, during the public health emergency, group health plans were required to cover COVID-19 tests and related services without cost sharing or prior authorization, including over-the-counter tests authorized, approved, or cleared by the FDA. So if you recall, the FFCRA said to cover the tests, and then the CARES Act said you have to cover out-of-network tests without cost sharing too. And then the CAA said, well, you have to cover the over-the-counter tests too. And under a safe harbor, a plan that provides direct coverage, meaning no upfront participant costs, of over-the-counter tests through a pharmacy network or direct shipping program could limit the reimbursement rate for each over-the-counter test to the lower of the actual negotiated price, or $12, and also could limit the number of free over-the-counter at-home tests for each covered individual to 8 per month. And this is just a graphic of that design that, showing the coverage requirements for COVID-19 testing during the public health emergency. So now at the end of the public health emergency, most group health plans will no longer be required to cover free COVID-19 tests, including over-the-counter tests. I think it's important to recognize the distinction between this and the vaccine is that it's not, or not yet, considered to be ACA preventive care. So employers will need to consider if they'll continue to cover COVID-19 tests as required by a doctor or over-the-counter without cost sharing. If applicable, cost sharing amounts that will apply. If covering over-the-counter tests, whether a $12 cap or other limitation, a number of tests per month will apply. And of course, the timing and coordination of any changes with the insurer or TPA is key. Keep in mind, fully insured plans may not be able to make changes mid-year. It may be a little more flexible for your self-insured plans. And of course, it's always important to consider any necessary plan document updates and notice requirements. For those employers who do continue to opt to offering COVID-19 testing and services without cost sharing, there are some other considerations. First, if the plan is an HDHP, a high deductible health plan, there could be a potential impact on HSA eligibility. The IRS had issued Notice 2020 2020-15, which allowed HDHPs to cover COVID-19 testing and also actually treatment with no cost sharing without conflicting with HSA eligibility. It's not clear if this relief will continue. So we're really still awaiting IRS guidance on that. That's an open question. The other issue to consider is mental health parity compliance. During the public health emergency, enforcement of certain mental health parity financial requirements related to the coverage of COVID-19 testing items and services without cost sharing was suspended. So after the public health emergency ends, employers may want to perform the financial requirements testing to ensure the plan remains compliant, particularly if the plan will continue covering COVID-19 test items and services without cost sharing. And keep in mind, of course, that mental health parity compliance is just a top enforcement priority. Okay, moving on to COVID-19 vaccine requirements. During the public health emergency, non-grandfathered group health plans must cover COVID-19 vaccines. That's all necessary doses and boosters, including administration, without cost sharing, whether provided in-network or out-of-network, and reimburse out-of-network providers a reasonable amount. Now, when the public health emergency ends, plans must meet the ACA preventive services requirement to cover COVID-19 vaccines at no cost, but only in-network. Employers will need to review their vaccine coverage with their insurer or TPA. Again, an insured plan may be limited by state insurance law with respect to coverage changes, especially mid-year. Budget for the cost of COVID-19 vaccines. Again, during the public health emergency, the federal government covered the cost of vaccines, but this will end. And determine the cost sharing. I'm sorry, can we just go back one there? Determine the cost. No, we're good. Go ahead. Determine the cost sharing amount for vaccines received from out-of-network providers. Okay, and just so we take a holistic look at the vaccine issue, many employers during the pandemic considered and many did offer some type of vaccine wellness program incentives. And employers can offer a COVID-19 vaccine incentive, such as a premium discount under their group health plan, if it's compliant with the HIPAA wellness rules. Before we even get into the rules, I think it's probably a good time now for employers just to reassess in general, whether they want to continue offering this incentive. And that is a question really to review with your employment law counsel, because with wellness programs, and particularly with the vaccine, there's always questions of employment law that come into play, as well as employee benefits law. But if employers do decide that they want to continue with this type of vaccine incentive, they need to ensure that the wellness program is compliant with the applicable non-discrimination rules. And the main ones that come into play here are the HIPAA wellness rules. So under HIPAA, a program requiring performance of an activity related to a health factor must be reasonably designed to promote health or prevent disease. It's usually not too hard to achieve. Provide a reasonable alternative standard, notice, or waiver to qualify for the discount if it is unreasonably difficult due to a medical condition or medically inadvisable to obtain the COVID-19 vaccine. Employers can, if there may be some people, let's say they're allergic to a vaccine, employers can ask, for some type of verification from a doctor, but they do have to be very careful here. And I know some employers just chose to sort of have a checkbox form. It's medically inadvisable that the healthcare provider would check. You don't want to go down the route of some inquiry that could be considered a disability-related inquiry and obtain more information than you need, and that would implicate the ADA and other non-discrimination rules. But in any case, moving on, that reasonable alternative standard, a waiver, another way to achieve the reward, has to be included. And there's a notice is provided, and it has to be included in all program materials. The incentive cannot exceed 30%, and employees must be able to qualify for the reward at least once per year. So again, emerging from the public health emergency, it's a good time to review that program if you're retaining one, to make sure it is compliant. Let's talk about COVID-19 treatment during the public health emergency. There is no federal law specifically addressing private insurance coverage of COVID-19 treatment or setting limits on out-of-pocket costs for COVID-19 treatment. But under the ACA, just generally, it does require non-grandfathered small group health plans to cover hospitalizations as part of essential health benefits. And it also, of course, sets annual out-of-pocket limits that group health plans may impose on cost sharing. Some carriers voluntarily covered out-of-pocket costs for COVID-19 treatments early in the pandemic, but later discontinued this policy. For fully insured plans, a few states required coverage of COVID-19 treatment, very few, during the pandemic. Many requested that insurers, provide the coverage, cover the out-of-pocket costs, but went short of a mandate. So what does that mean post-pandemic? Really not many changes with respect to coverage requirements. There aren't federal or really other mandates to reverse. Costs may increase, as we've discussed, as government purchase treatments run out, leaving private insurers to take on more of the costs, which may increase premiums. So employers should contact their carrier or TPA to discuss coverage and costs and budget accordingly. Okay, moving on to grandfathered group health plans. And I realize there aren't many of them out there, although the few that are out there tend to be larger. During the COVID-19 emergencies, there was relief guidance that stated, if a grandfathered plan added benefits or reduced or eliminated cost sharing for the diagnosis and treatment of COVID-19 or for telehealth and other remote care, that the plan would not lose its status due to those changes being reversed after the emergencies end. Because if you think about it, absent this relief, increasing the percentage cost sharing requirements or decreasing the benefits could impact the grandfathered plan status. So employers that sponsor grandfathered plans, will need to notify participants if there are changes. If they made those enhancements and now they're reversing them back, notice is necessary, but removing the benefits that were addressed, that were added during the COVID-19 emergencies, it will not cause the plan to lose grandfathered status. Okay, standalone telehealth will end. Now, this was another relief option that I'm not aware of too many employers who took advantage of this because it was limited in scope. Basically, the CARES Act provided relief for standalone telehealth arrangements that were made available only to employees not eligible for coverage under any other group health plan offered by the employer. So it would have to be a situation, for example, where maybe they wanted to offer the telehealth to part-time employees. These arrangements were not subject to certain ACA requirements that would otherwise apply, such as your annual limit prohibitions, your SBC requirements. The relief was extended, though, only through the end of the plan year that began during the COVID-19 public health emergency. So if the public health emergency does indeed end on May 11th, the standalone telehealth benefits would need to be terminated at plan year end. That would be December 31st, 2023 for a calendar year plan. And of course, notice would need to be provided to affected employees. Just want to make a distinction here. We're talking about telehealth. because there's a lot of confusion. And while that last relief may not have been too popular, we know that there is other telehealth relief that is quite popular. And this, under the CARES Act, it initially allowed high deductible health plans to provide telehealth with no deductible without affecting a participant's HSA eligibility. And this relief originally applied to plan years beginning on or before December 31st of 2021. Subsequent relief guidance extended that period, extended that relief for the period from March 31st of 2022 through January 1st of 2023. So unfortunately, this left a 3-year gap in 2022 in which free telehealth services could impact HSA eligibility, and that has not yet been resolved. However, the Consolidated Appropriations Act of 2023 extended the telehealth safe harbor that was effective for plan years beginning after December 31st of 2022, but before January 1st of 2025. So this relief is welcome, but not tied at all to the public health emergency. Okay, EAP designs, some of them may also require review. For the duration of the public health emergency, the CARES Act allowed EAPs that otherwise met the requirements to be an accepted benefit, meaning not subject to certain ACA reforms, such as annual limit prohibitions, the H26 rule, the SBC requirement, to cover COVID-19 diagnosis, testing, and vaccines without risking accepted benefit status. This COVID-19 coverage would not be considered, quote unquote, significant benefits in the nature of medical care. So that the determination of whether an EAP is providing significant benefits in the nature of medical care is a subjective one, but is an important one because if it's determined that it is, then it really becomes a full-blown health plan and subject to all the ACA requirements. So that's generally something that EAPs are trying to avoid, and that was hence the relief guidance here. However, that relief is temporary, so employers that added those COVID-19 benefits to an EAP will need to really review with their counsel whether continuing this COVID-related coverage after the public health emergency ends will jeopardize the EAP's accepted benefit status. And if the coverage is discontinued, again, employees need to be notified. Okay, so I've been ending a lot saying employees need to be notified. Let's look a little more closely at those notification requirements. And like many things with the public health emergency, there's some special rules, so it may not be all that simple, but let's just take a look. Normally, if there is a material change to the coverage terms that affects the summary of benefits and coverage, the SBC, then plans and insurers must provide participants with 60 days advance notice. And that also covers ERISA's summary of material modification requirement. However, during the public health emergency, there was a special rule that said if a change affecting the SBC increases benefits or reduces cost sharing for COVID-19 diagnosis and treatment or telehealth services, the employer could just notify employees as soon as reasonably practicable. And the relief also extended to the reversal of changes when the public health emergency ends, if the plan either previously notified participants of the duration of the additional coverage or reduced cost sharing, meaning that when they originally send out the notice, hey, we're enhancing these benefits, this is available to you. However, it's only available until, the end of the public health emergency, and explaining that it was temporary in nature, or alternatively, they notify participants within a reasonable time frame in advance of the change reversals. I have the guidance cited there where that comes from. So there's some relief there. Now, if the SBC content is not affected, but there is a benefit reduction, the employer would normally just then need to send a summary of material reduction in benefits, but that's within 60 days of the adoption date of the change. So that's not in advance. However, in all of these cases, despite all this relief, advance notice may be advisable. Even if you sent out a notice some time ago indicating that this will change at the end of the public health emergency, it's likely a lot of participants don't recall that. Some may be, ordering COVID tests and not aware now you've changed the cost sharing. So I think really it's advisable to send notice in advance, even where it's not technically required. All right, just wrapping it up here for the public health emergency employer action items. First of all, expect a possible increase in mid-year enrollments. Determine cost sharing and coverage for COVID-19 testing. Consider mental health parity compliance and HSA eligibility as applicable. Determine out-of-network cost sharing for vaccines and administration. Budget for an increase in COVID-19 vaccine and treatment costs. Reconsider review any vaccine incentive wellness program. Understand standalone telehealth must end. Review a post-PHE EAP design, particularly if it offered COVID-19 testing and coverage and you're planning to continue those. And communicate plan coverage and cost changes timely and clearly to participants. And with that, Beth, I will turn it over to you to cover the end of the COVID-19 national emergency and the benefit implications there.
Before we transition over that, why don't we answer a couple of questions that have come up during your talk?
Thank you.
For instance, as you described, Carol, there are a lot of requirements that were imposed upon benefits during the PHE, that is the public health emergency. But if, for instance, if we could, if we impose some requirements on the testing coverage, for instance, the things that are required to be covered with no cost or no cost sharing. If the employers decided to keep that coverage, can they continue it after the public health emergency ends?
Well, they can certainly continue it if they want to. I mean, you're talking about the coverage without cost sharing. I mean, they can certainly choose that if they want to. There's just no requirement to do so because it's not or not yet considered preventive care. Whereas the vaccines are considered preventive care and they have to be covered without cost sharing in network still after the public health emergency ends. That's not the case with the testing. So there's just a lot of freedom there to make changes. Again, with your insured plans, you may not be able to do so mid-year.
Right. I guess the operative concept here is that even though the requirements may end, the employers may choose to extend them if they felt they.
Sure, they certainly could.
Right.
And maybe many will. We'll have to find out.
Right. We got a question in the chat that I thought was pretty interesting, kind of, I think, highlights some of the limits on this discussion. And the question was, if the employer requires that employees be vaccinated, do they need to pay for an employee's COVID-19 vaccine after the public health emergency ends?
So that's gonna. Oh, go ahead, Carol.
No, go ahead. I mean, that's probably gets into more like an employment law
It does.
issue. So yeah, I don't know if we want to address that, but I mean, I think that it is important to recognize, that the cost of those vaccines will increase. There's no government funding there, so it may become more of an issue.
Correct. And yeah, I mean, rules under the ADA and kind of that requirement, if you're requiring any type of testing like that for employment purposes, is going to be implicated. So that's something to discuss with your employment law attorney. One thing that I'll jump in with, Patrick, and we did get the question. I'm surprised it took as long as it did. We did not choose to focus on state changes Okay. And so there are some states that require certain COVID treatment be provided without cost sharing. There are states who require certain COVID leave. You will need to follow those states to determine kind of what happens. I don't know offhand if any or all of them or just some maybe based their relief based on the national emergency or the public health emergency. But those states are going to kind of have to decide that. And we did not focus on that in this presentation.
Yeah, no, I mean, I think I mentioned it, Beth, and there was very few that actually had treatment mandates. I think they had, and I know you and I have discussed this before. A lot of them went short of saying it's a mandate. You know, we really would like our insurers to cover treatments without cost, without any out-of-pocket costs or without cost sharing. But they didn't have any specific requirements. So I'm not sure. I'm not sure how much there is to be concerned with there. But there were some states, and it's also possible with some of the other requirements that states may impose requirements to cover things like testing, right? I suppose that's possible.
Correct. All right, so I think those were good questions, a good discussion, and we're going to switch gears now and address the end of the COVID-19 national emergency. And so the reason, or the biggest reason I think that most of us are familiar with the national emergency has to do with the extension of certain timeframes that several of the government agencies impose. So like the DOL, the IRS, technically I think HHS, were involved in providing this extension of certain timeframes. Okay, so to remind you what happened back in May of 2020, the agencies basically required plans to disregard the period from March 1st, 2020 until 60 days following the national emergency for certain deadlines under ERISA. And mind you, that kind of period between March 1st, 2020 till 60 days after the national emergency was coined the outbreak period. And the idea was that the outbreak period during that time, the deadlines that would normally come and go based on, let's say, 30 days or 60 days would basically be told or disregarded for COBRA, HIPAA special enrollment rights, claims filing and appeals, and external review. Now, it's very interesting because I went back as I was preparing for this presentation and I looked at the original regulations that we got on this requirement. And believe it or not, in the examples that they gave of how their rules work, the government used as an example or a sample end of the outbreak period or the end of the national emergency, they used the date of April 2020. And so their examples were basically like the outbreak period would end in June of 2020. And I think now that we are all staring down the barrel of basically April of 2023, I think we are all somewhat shocked, including the government, that it has gone on this long. I don't think any of us knew that it would be like that at that point. But I thought that that was definitely a telling thing about this particular requirement. And I also kind of lends itself to the idea that a lot of employers may not even know that this is still going on, okay? Now, mind you, we did have some clarification from the DOL that came out because we got that guidance in May of 2020. And then later on, we got the DOL to come out and clarify that basically their statutory authority was actually limited in the relief it could give to basically 1 year from the date that the relief was going to be provided to the individual. And so that meant that even though the outbreak period was dragging on and did so for years, any given person who receives this relief would only be entitled to up to a year of relief, basically plus the amount of time that the normal deadline would be. Okay, and so this is kind of just a look back into how we got to this requirement of the extension of certain timeframes and what it meant. And then also, as far as the specific timeframes that were involved, for special enrollment rights under HIPAA, that was going to toll or have a period, the outbreak period, be disregarded before the 30 or 60-day period that you have to request a HIPAA special enrollment right. Under COBRA, there were several periods that were affected, and these kind of all operated differently as they do under COBRA. But the election period, or the amount of time that someone has to actually elect COBRA, was one of those. The amount of time that someone had to actually notify the plan that they experienced a COBRA qualifying event, like let's say a divorce or a dependent aging out of the plan, was also one of those. The 14-day deadline for plan administrators to furnish COBRA election notices was also one of those. Interestingly, I don't know that many employers took advantage of that deadline, especially if they had vendors. Vendors would just go ahead and send out the COBRA election notices, especially considering that individuals had even more time to actually elect COBRA. I think a lot of employers went ahead and got these notices out. However, there might be some employers, for example, who failed to get the notices out and they did need to rely on this relief because, they didn't send the notices out like they planned. And this relief kind of gave them a year to potentially do that. And then lastly, the 45-day deadline for participants to make that first COBRA payment, and then the 30-day deadline for subsequent payments was also one of those concepts or periods that was told under this requirement. And then lastly, the deadlines for filing claims, appealing claims, providing state and federal external review process, those were the other things that were kind of included in these timeframes that were now going to be extended. And so with that in mind, what is the outbreak period, right? And so the basic rule that was introduced when this concept came into being was that the outbreak period was the period that is from March 1st, 2020 through the end of the national emergency plus 60 days, okay? Now, mind you, the national emergency is currently set to end on May 11, 2023. And I kind of put that currently in italics instead of, let's say, an asterisk, because technically, as Carol mentioned, the White House merely indicated their intention for the period to end. We definitely think it is likely going to end that day because there are other kind of congressional pressures for this period to end. And I think we've all kind of gotten to the point where we're tired of COVID-19. But keep in mind that something could happen and it could go longer. Okay, but for right now, we are going to proceed as if the last day or the outbreak period is going to be over based on the end of a national emergency being May 11th, 2023. And so that means that the final rule is that basically the outbreak period is March 1st through 2020 through May 11th, plus 60 days, and that puts the end of the outbreak period on July 10th of 2023. Okay, now we're going to go through some examples that kind of bear this out as some more, but keep in mind that generally that means that the deadlines for these type of events are going to begin running normally beginning on July 11th, 2023. Now, a couple things that you just don't want to forget as we're talking about this and before we go into some examples. The outbreak period is told or disregarded, okay? And so that means it's like you just don't even count that period, right? And so, whether it's through the end of the outbreak period or it's for that year of relief that somebody would have been entitled to, it's kind of like that period just is not even counted, okay? And then the normal time frame or number of days until the deadline that's normally provided under the event is going to be added on to that disregarded time, okay? So they're not consecutive, right? Like it's not like the outbreak period, the normal 60 days I would get for the opportunity to elect COBRA falls within the year that I get. No, it would be the year plus the 60 days, okay? The exception to this, and that's kind of the idea that like, okay, the end of the outbreak period plus 60 days, or the end of the national emergency plus 60 days is what someone normally has. The only exception to this is the period is basically shortened if the event was a year ago or more, right? And so if we're talking about present time, if the event was more than a year ago, then that person only got a year of relief, okay? And so their relief period is going to be based on kind of whenever they first were entitled to relief, and then a year goes by, if that year is not, already gone up to at the time of the end of the national emergency. So that was kind of just a high-level way to say how it works. Let's go through some examples, okay? So the first example is with HIPAA special enrollment rights, and an employee had a baby on January 1, 2023. How long does she have to request a HIPAA special enrollment right? So usually her plan allows 30 days following a birth for the employee to request a HIPAA special enrollment, okay? However, under the COVID-19 national emergency, that deadline is extended either by the earlier of 1 year or until the end of the outbreak period. In this case, because the outbreak period is expiring on July 10th, 2023, and that is not a year from when the baby was born on January 1, 2023, that means that the period that's disregarded is the period from the birth through July 10th, 2023, which is the end of the outbreak period, okay? And so that means that this employee has until 30 days following the end of the outbreak period or August 9th to request enrollment in for that baby on the plan, okay? And it's not just that baby, it's actually employees who maybe didn't enroll themselves, so they can enroll themselves, they can enroll their spouse, they can enroll the baby. They have the same HIPAA special enrollment rights they would normally have, including the idea that they could switch coverage as well. Now, keep in mind, this relief doesn't apply to permissible qualifying events. So remember that when we talk about qualifying events, there are HIPAA SARES or special enrollment rights, which are mandatory. And then there are permissible qualifying events, which are not mandatory. They're just allowed if the employer chooses to recognize them, okay? And so for those permissible qualifying events, they don't have this relief. It really just applies to HIPAA special enrollment rights, which only allow for potential enrollment in coverage. So that doesn't necessarily allow for employees to drop that coverage, okay? So keep in mind those kind of high-level concepts as well. So let's do a different example on the HIPAA special enrollment rights piece. Let's say that the employee, instead of this January, had a baby back on June 1st, 2022. How long did she have to request the HIPAA special enrollment? And I should have put maybe she or he here because technically the father could also choose to cover their baby. But the plan normally allows 30 days following the birth for the employee to request the HIPAA special enrollment right, just like before. However, the COVID-19 national emergency means that the deadline's extended for at least a year or until the end of the outbreak period. The outbreak period is still July 10th, 2023. And that means that the period from the birth, June 1, 2023, and I should have put here what through a year basically is disregarded, right? And so accordingly, the last day for the employee to request a HIPAA special enrollment is going to be 1 year and 30 days from the child's birth, right? So the child was born June 1st, 2022, so a year from that, and then an additional month is what is going to basically happen, okay? And so that is just a second example of how the HIPAA special enrollment rights would work. When we go to kind of COBRA, very similar concept. An employee is terminated on October 1st, 2022, excuse me, with health coverage ending that same day. The employee is a COBRA qualified beneficiary and received an election notice also on October 1st, 2022. How long does that person have to elect COBRA? Now, normally they would only have 60 days to elect COBRA. However, under the COVID-19 national emergency relief, that deadline is going to be extended by the earlier of 1 year or until the end of the outbreak period, okay? And so again, the outbreak period expires on July 10th, and that's earlier than a year from October 1, 2022, okay? So that means that that qualifying event through July 10th, 2023 is going to be disregarded, or the time period is going to be disregarded. And then the deadline starts to run on July, basically 11th, 2023 for 60 days, excuse me. Okay. And so accordingly, the last day for the employee to elect COBRA is going to be September 8th, 2023. Now, mind you, COBRA, I think, is a little different because the regulations made it very clear that COBRA, if someone elects COBRA this way, they have to basically elect it retroactively back to the date of the COBRA qualifying event. So in this example, they would have to basically elect COBRA going all the way back to October 1st, 2022, and they would be made to pay for it as well. Okay, so keep that in mind that a lot of people didn't really, elect this because they would actually have to go back and pay for that COBRA over that period of time. A second example having to do with a COBRA payment is the idea that on July 14th, the covered employee experienced a COBRA qualifying event and received an election notice the same day. The employee elected COBRA on October 1st, retroactive to July 14th, right? Because that's when their COBRA qualifying event was, and did not make a premium payment with their election, okay? So when is that premium payment going to be due? Normally, it's a 45-day deadline to make an initial premium payment, but that is now going to be, that period of the outbreak period is going to be disregarded, right? In this case, the outbreak period is going to expire before the 1 year from the time of relief comes in July 14th or July 13th of 2023, technically. And so that means that the time from the date that the election notice was provided until July 10th is disregarded. And basically, that's going to give the employee 45 days after July 10th to make the first payment. And it's really the first payment and all the ones that are due up to that point, okay? And then after that, you know, their regular due dates would potentially come based on their normal schedule. Now, that's kind of a discussion of HIPAA, SARAs, and COBRA, but let's talk a little bit about FSA, or claims administration. And this one is interesting. And I think that kind of there was different relief having to do with FSAs. And so I think it kind of begs the question of what this relief was for. And remember that, you know, we're talking right now about the national emergency and extension of certain timeframes, but there was also relief that allowed for employers to choose to make certain changes to their FSA, carryovers, and grace periods. Okay, that's not what we're talking about here. And I want to just give you a brief kind of description of the three concepts so that you understand what this one applies to. Okay, so normally with the FSA, you can have a grace period, which is an additional amount of time after the end of the FSA plan year that the person can still basically go out and incur claims and have those be paid, okay? And so that usually is the first couple months of the year that you can have an additional amount of time to incur claims, okay? Versus a carryover, which allows for you to take the money that you would normally use or lose from the FSA and carry that over into the next FSA plan year. That would be a carryover. Neither of those are what this is. This is actually more of a run out, okay, or a claim submission deadline. And that's the idea that you have a certain amount of time after the end of the plan year to go back and submit substantiation for the claims that you incurred during the plan year. Okay, so that's what this is getting at. And so with the scenario where an employer's health FSA has a claim submission deadline of 90 days following the end of the plan year, that's normally March 31st, 2023 for the 2022 plan. The COVID-19 national emergency is going to extend the deadline to submit those claims by the earlier of 1 year or until the end of the outbreak period. The outbreak period is going to expire on July 10th, 2023, which is earlier than the 1 year. And so beginning kind of July 10th of 2023, health FSA participants would have 90 days to potentially submit any claims for the FSA that ended, let's say, with the calendar year 2022. Okay, so that would be October 8th, 2023. One final example to show some love to the retirement side is on the pension plan side. Same thing, where under ERISA, pension plans can have certain appeals rights. And so let's say an employee receives a notice of adverse benefit determination from their employer's defined benefit plan on September 14th, 2022. They normally have 60 days to file an appeal. Okay, outbreak period is going to end on July 10th, and that's earlier than 1 year after the employee received the adverse benefit determination. And so what that means is we're going to start counting that 60 days that they would normally have to submit their appeal from the end of the outbreak period. And that would give them until September 8th of 2023 to submit that appeal. Now, we also got, interestingly, some additional relief from the agencies. When they announced the extension of certain timeframes, they also gave us some information on kind of just relief for employers from compliance obligations, just to make sure that they were kind of giving employers space to be able to submit things to participants, to send out notices in a way that, you know, acknowledged the fact that a lot of employers were sending employees home, remote work was happening, employers were trying to figure out how things worked, and how, you know, things that they might have done in person at the office were going to be translated to being done with large chunks of the workforce being at home. And so they kind of came out and said, okay, look, for some of these other obligations under ERISA, like timely furnishing your notices and verifying plan loans and distributions, or forwarding participant contributions, you know, issuing blackout notices, doing some Form 5500 and M1 filings, and just your general ERISA fiduciary compliance altogether, We're basically going to say that, if you have some kind of failure, as long as it's kind of, it just kind of happened as a result, basically, of the COVID-19 outbreak, and as long as you make a good faith effort to comply, then we're not necessarily going to cite you for that, okay? And this was also relief that was provided along the lines of the national emergency, okay? Now, I will say, because the relief here very strictly, I think, or very explicitly rested on kind of the employer making a good faith effort, and that any kind of delays on the compliance here were actually based on the COVID-19 outbreak. I don't know how much wiggle room they gave employers, frankly. And so I think if I had to kind of come away with what I think about this type of relief, I really think that if employers were in a position to be able to comply, then they probably should have. This relief didn't necessarily go the next step and say, oh, you do have a grace period. Like, it didn't say that. It was more kind of like, well, if you end up needing one, basically, for a good faith reason, and you make some effort, then we're not going to cite you if some things happen later than they normally should. Okay, but keep in mind that that is relief that was available for that time period that is going to end as well. So as far as next steps for employers, talking about documents and notices, I think this is really interesting as it pertains to the extension of certain timeframes, because I also think that people like myself and the benefits compliance team were a little annoyed with the government with the extension of certain timeframes because they did not require notice. And so we got a lot of questions from a lot of you all, like, hey, do we have to tell employees that they have this additional time? Are we obligated to do that? And the government did not actually require employers to do that. Now, it made sense because a lot of plan documents give the regular deadline to these events, right? And so in the event of the extension of certain timeframes, then technically those documents probably should have been amended, and either a summary of material modifications or some other notice being sent to notify employees of that change. But in our experience, employers and even vendors didn't do that great with this, right? But going forward, obviously, if documents were amended, if notifications were sent out that these deadlines were changing, then now it's time to make sure that they get put back after the outbreak period ends, right? So it should go back to normal so that everybody understands that now we're operating under the regular rules. Likewise, you might want to consider communicating the expiration of the deadline. Again, it's not required by the regulations or by the regulators, but it's probably a good idea so that you don't have any employees still thinking that they have access to that relief. Likewise, you probably will need to connect with your COBRA administrators to just make sure that COBRA notices, if they were updated with the time extension of certain timeframes information, are put back to reflect the original deadlines under the plan. I will also say that we're running into some kind of interesting issues as it pertains to kind of this extension of certain timeframes and people who may or may not have elected COBRA. We're starting to see some situations where, let's say, a stop-loss provider finds out that there's a person who may be terminated from the company or went on disability and maybe should have been dropped from the plan. And maybe the employer is trying to come in and say, oh, well, technically they're still in their election period under the extension of certain timeframes. And the stop loss has to recognize that, right? Unless the person went beyond the 1 year. But keep in mind that that is going to end. So you might also want to make sure that you are really paying attention to the fact that those COBRA election notices are going out and people are being offered COBRA if they are no longer eligible under your plan. So additional steps as far as just operationally, employers are going to want to review their procedures for administering HIPAA special enrollment rights, COBRA elections, and premium payments. I'll also say, you might want to look and maybe do an audit now about whether or not this was ultimately done correctly. And I think that that's important from both the standpoint of PHE and the NE. And the reason I say that is because usually the government, especially the DOL, when something of this magnitude occurs, afterwards, they will generally have some kind of task force or some kind of group that is dedicated to going back and looking to see if employers actually complied with the relief that was given. And so I have to assume that we could see some audits of this or some questioning of this to make sure that employers were actually doing what they were supposed to do. And you want to be ready for that, right? Like you want to know, okay, yes, during this period of the outbreak period, if we had people who requested HIPAA special enrollment rights, let's say a few days after their the normal 30 days, that we actually let them do it because we were required to. And so that's something that you want to know about, and you don't want it to be a regulator who's coming in to tell you that for the first time. Okay, so you might want to look into those things and then document everything. And then that's kind of all the information. And Patrick, I hope you have some questions or something to talk about because we have like 5 minutes left. But one thing I will mention is that we have a publication, which I should have put this as a publication. And so we have a publication that will be available shortly, and you can ask your advisor for one that goes through kind of all the stuff we talked about. And I think it's definitely helpful just to have that as you are preparing for this time to come. We're all hoping that May 11th is going to come, and this actually does, happen. But I think that, there might be some questions that definitely start to arise once that time comes.
Well, Beth, I think the question that we can look at what in the time that we have left concerns, say, let's have a special enrollment right that had started, say, April 1st of 2022. Mm-hmm. Now, because the emergency is going to be ending on May 11th, a person who has that special event on April 1st, 2022 doesn't have until after May 11th, correct?
April 1st, 2022 or April 1st, 2023?
I said April 1st, 2022. All
right. So April 1st, 2022, their year is up, right? So their 30 days would start on what? April 1st, 2023?
Right.
Right? Yeah. Right. So yeah,
right.
So they basically their period would be told out because they got to a year. And in that case, it wouldn't really matter kind of where it is compared to the national emergency, because the national emergency ends after that.
Right. It's just worth highlighting because we've been talking about the May 11th deadline or date, and just wanted to emphasize that there is that other deadline to worry about as well.
Absolutely. I see a question here. Do we have an obligation to notify someone still in their extended election period for COBRA that the enrollment period now has an end date? And again, I think this goes back to kind of what Carol and I were saying, like the regulators didn't do us a favor here because they didn't require a notification. But it is definitely a situation where if you did originally, let's say, tell them that they were going to have up to a year, that you might want to come back now and correct that, especially if that's going to change based on when the national emergency ends. I really think as it pertains to just communications period, if you communicated things that will no longer be true as of, let's say, July 11th, 2023, then you probably want to communicate that they are no longer true, right? I think that's helpful, and it kind of puts everybody in the best position to kind of know exactly what the rules are and what they're dealing with, even if the government did not require employers to do any kind of notification.
Indeed.
One last question, anyone? We have about 3 minutes left.
Let's see.
I'm looking through the Q&A to see if there was anything interesting. I saw a question, and this probably has to do with the PHE, about whether or not the insurer or the group healthcare provider will inform participants of the changes related to COVID. And I do think that it's interesting. I think insurance certificates and things like that will likely be changed. I don't know how much. Well, I take that back. I will say that I know, for example, that a lot of the insurers, as it pertains to COVID tests, have been sending out communications ever since the announcement of the end of the national emergency or the PHE to say, hey, order all your COVID tests now because this is about to end. And I know that I personally ordered, 8 COVID tests for all the people covered under our plan because that is going to be ending. And so I will say that although I don't know that healthcare providers are necessarily taking the steps to, tell participants of all the ways that the coverage will potentially change, I know there are certain things that they're definitely already announcing, right? Specifically having to do with COVID tests.
Right.
Yeah, and I think that, another thing, and there was a few questions about this and just having to do with like HSH, HDHPs, and what that will look like, depending on what happens after the national emergency. Obviously, we know that, the vaccines, as Carol mentioned, are going to be preventive. It still remains to be seen whether or not the IRS will come out and say that tests are also preventive. Hopefully that'll be a thing. Right? Hopefully they'll potentially do that because we probably all still need to have tests available. And so we'll have to see kind of what the IRS does with that. But theoretically, they would have to be offered with a cost, right? Here after the public health emergency ends. And so I think that's good. Thank you, Patrick, for moderating. Amber, I'll turn it over to you for you to do our outro, and thanks everybody for participating today.
Thank you to our speakers for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We'll be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you everyone for joining us, and have a great day.